One of the things that's really important for a good OCD therapist to do is offer the right level of validation and reassurance. So if we think about someone coming to therapy who is having intrusive thoughts about killing themselves, every time they pick up a knife or go near a cliff edge, they're like, oh, shall I stab myself? Shall I jump off this cliff? Shall I end my life somehow? And they're really terrified that they might act on this. And so they're probably constantly reassuring themselves by talking to loved ones, by talking to doctors, by talking to AI. Now, what I sometimes see therapists do is that the client will come in and say, oh, I'm really worried that I'm going to kill myself. And the therapist will say, well, you're not gonna. Let me reassure you that you're not gonna. And that can feel very good in the short term, but it's unhelpful in the long term, because what the therapist is doing there is giving the person the same reassurance that they're getting out in the world from their loved ones, from AI, from their Google searches, whatever it is they're getting that reassurance. And that's one of the issues with OCD, is that we have this really intrusive thought that makes us feel awful, and then we go do some checking to make sure it's okay, and that in the short term makes us feel better, but in the long term maintains the OCD. So in terms of offering reassurance, I'm quite careful what I give to my clients. If a client's in a really difficult situation in the moment, I might give them that reassurance temporarily. But I'm far more likely, if a client comes in and says to me, Dr. Chris, I'm really worried that I'm going to kill myself, I'm far more likely to respond with something like, so that must be terrifying. That must be so scary to constantly be going through that. And that, I think, is far more therapeutic in the long term for OCD, because what we're now dealing with is the really difficult, painful emotions that come up when these intrusive thoughts come in. And typically, why someone will find themselves trapped in this OCD cycle is they'll have the intrusive thought. That will make them feel awful. They'll go off and engage in some reassurance seeking, and then they'll feel better temporarily, but then that uncertainty creeps back in, and they're back in the same cycle. So much more effective OCD therapy is to look at, okay, so when you have that intrusive thought and you feel so scary, so terrified that you might act on them, how do you respond to that? What do you do there? What techniques can you use? How do you deal with that really difficult emotion so that you don't need to go through this cycle of reassurance? So that's something, if you're looking at an OCD therapist, I'd maybe consider, okay, how much reassurance, how much validation is this person providing? Because there is a useful level, but sometimes what the therapist will do is replicate all of that reassurance seeking that you might be doing out in the real world, and therefore maintaining that cycle of OCD.